So I do have a question. So I know with post-traumatic growth, one of the important features is as you're going through the trial or crisis or stressful event, is you should avoid adapting maladaptive coping strategies. So that's a fancy way of saying um, unhealthy habits to cope with with everything that you're dealing with. But it's also important that schools and parents play a role in that. So I'll start with schools. What are some things that you're seeing? You work with a lot of different schools across the nation. What are some things that schools are doing that you see that are specifically helpful or incredibly helpful for students?
Yeah. So one of the biggest things in all these crisis events, but in this pandemic as well, is we have to kind of recognize that kids are not going to learn as much information and teachers are not going to teach as much information. And, the world has changed and so the curriculum has too. And so we have to alter our expectations. And I think schools that deliver that message most effectively, that say, look, we're going to give you a good education. We're going to meet you where you're at. We're going to continue to challenge people that are ready to learn even more. But we're going to recognize that you might benefit from a little bit more assistance and support, and we're going to do that too. And I think that message has to come from the superintendent, from the principal, from the teachers, and I think it also, the trickiest part, and I spend a lot of time on this when I'm working with schools, is I think the teachers have to accept it for themselves and the counselors have to accept it for themselves. There's only so much they can do. And if they're doing good, that's good. And they're not going to be able to take care of everything for everyone. And quite honestly, even before the pandemic, they weren't able to either. So I think the most important message is to be honest, to be genuine, to be authentic, to acknowledge the fact that this is difficult, to not pretend that we can go back to the way we were. And I also tell people, please don't use the term new normal, because there's nothing normal about a pandemic. And I think whenever you say it's the new normal, it suggests we're supposed to be okay with this. And I'm not okay with it. I don't think there's anything normal about it. It's our shared reality. And we have to figure out how to deal with that reality the best we can. But I don't call it a new normal. And the other thing I've been telling people is everybody keeps referring to us as where we are in the recovery phase. I don't think we're in recovery yet. I think we're still dealing with the pandemic. I think it's evolving. It may actually get worse. And I think if you tell people that we're in stage 3 of recovery, it suggests you should be getting over this by now. But I don't think people are ready for that yet. So I think we have to have, for me, probably the most important thing is realistic expectations, honesty and authenticity, and then providing the support and assistance. Because the post-traumatic growth requires not only personal resiliency, but actually adequate support. And so we need
Talk,
to accept that.
can you talk about specific supports that offering to students would be helpful? Like at our school, we actually do offer a lot of groups. We're all trained in CBITS, for example. So students that are experiencing trauma, we have a group for them. We provide groups on anxiety. We know there's been increase in anxiety. We try to offer a lot of groups for students to join that sometimes are just social and fun to maybe help with increase of depression. So offering groups is something we've tried to do. What else do you see, as far as specific ways to support the students? Individual therapy might be one, but what would you recommend?
Yeah. So part of what I'm arguing now is this is affecting everybody. So there is a tendency in schools to kind of use what I call the medical model, which is we try and screen people for problems, we identify it, we evaluate, we diagnose, we treat, and we refer. And that does not work in crisis situations like this for the vast majority of people. And we really have to kind of do more universal support. What are we going to do to help everyone without trying, they don't have to say that they're abnormal, they're struggling, they're doing poorly, they're abnormal. I think it's normal right now to be distressed. It's a distressing situation. So I think we all have to figure out what we're going to do for each other and for ourselves. Because so a lot of the groups that you're talking about, some of you describe them for social function. That's great. That's what we want to do. We want to build social connectedness. We want to do that even when kids aren't having problems. I mean, I mentioned all the stuff that I did in music. That was my social group for a large part. And I didn't do that because I was socially inept or because I was musically challenged. I did it because I wanted to do it and it was fun. And that's what we need to keep doing. So I do agree that we need to have our support staff and really all of the staff in the school better able to help kids who are feeling distress, worries, anxiety. We need to help them learn coping strategies, but I think we need to do it in a way that doesn't suggest that they have some disorder, problem, or disability, but just because it's a hard time. So, part of what I did, for example, is I, my older daughter is in Southern California. That's one of the reasons I'm here. And so just made a decision. I've been working really hard and I work like 7 days a week, but actually Friday afternoons she's off. That's the way her schedule works. And we get together and spend time with her dog. We have to do it outside, physically distanced with masks. We go out for ice cream. You walk up to a window, you order on an app. It's like, it's safe. But so when people ask me about my schedule availability, that's not available. Like those couple hours, because I realized otherwise I'm just going to work nonstop and I'm going to lose it. So there's a certain amount where I'm not in therapy, but I'm scheduling something that allows me to have some, time that will be helpful for me.
Therapeutic.
Yeah. And so
Yeah. You
I
can
think
do
that's
things that are therapeutic that aren't therapy.
right. And now you want
Yeah.
the professionals to understand the therapeutic skills. And obviously there are some kids that are going to benefit, want, and even need more. And then yes, so CBITS is it's cognitive behavioral intervention for trauma in schools. So it is a treatment approach for individuals who are having symptoms of post-traumatic reactions or post-traumatic disorders. We need that for kids who have that, but we should be teaching coping skills to all children because all children are going to have stress and they're going to have things which are going to cause them distress, but they're not necessarily a disorder.
So so one of the you mentioned universal support. So one of those would be universally teaching coping strategies to all students, for example. What are some other examples of universal supports that are helpful for kids now?
Some of it is we need to teach kids strategies for dealing with distress, and so that might be things like expressive methods to be able to express what's bothering you, safe ways of distracting yourself that are healthy. You can do mindfulness techniques. You can use guided imagery. So you can teach those techniques. I actually got some training in to do self-hypnosis with patients. And I taught my kids when they were young self-hypnosis. Not because they had any problem, but just, frankly, I thought it was a little more interesting than reading the same book every night. It just, for bedtime, it would be more, let's go imagine that we go to that special place. And, I wasn't hypnotizing them, but I was teaching them how to use that skill themselves. And they ended up using that. I didn't consciously do that, but I remember my daughter was, I think, 7 or 8. She had to have 4 teeth removed. And she went into the dentist and I asked the dentist, can I come in and use some self-hypnosis coaching with her? And he was like, sure, I don't care. So I did that with her. And they used Novocaine. I mean, they had injections of Novocaine. But I remember at one point she just turned to the dentist and she said, when are you going to get started? And she was bleeding from 4 holes in her mouth. So I don't understand. And he was like, we're done. And she goes, I didn't know you started. And I've just never seen that. And she was so proud of that for a while she wanted to be a dentist or a dental hygienist. Cute. She was like, I like going to the dentist. I'm proud of going to the dentist. And she's never had a cavity. And so only had a good experience. So you can teach people, the mindfulness techniques, yoga, use of exercise, all of these strategies are ways to manage, how you feel and how you cope, in addition to everything else that they can be used for.
And I think what's important about what you're saying too is, there's all these different strategies and there's not like a magic bullet. Like there's not one that works for every single person. And so it's so valuable to get to try different things and to kind of experiment and see what fits for different people too.
Yeah, I will say is, that sometimes that isn't appreciated by people. They have like their technique and they want everyone to do it. You know, they're like, everyone should do yoga. To be quite honest, I have some middle ear dysfunction. I've never been able to do a forward roll. I never could do it. I have never actually done it once. I fall over. There's something about my middle ears. So I don't want to do yoga. You know, people say you stand on your head. I would just get nauseous. So that's not going to work for me. And I had some people talk about, well, you know, you just have to take deep breaths. Well, I actually have cough variant asthma. And so when I take a deep breath, I feel like coughing. And so I actually dislike it because people will say, take your breath, and they start counting. And I'm just sitting there going, I'm going to start coughing. Like, I don't want to cough in the middle of a conference when everyone's holding their breath. So, you know, I said this to someone. They said, all you have to do is deep breaths, belly breathing. And I said, it doesn't really work for me. Like, I'm sure it works for some people. I understand that, but it doesn't work.
And I would guess also to, you know, your expertise as a developmental behavioral, you know, pediatrician, that also maybe some of these might work at different stages of people's lives. Like, you know, maybe something that I do when I'm, you know, 5 years old to help calm myself down doesn't work when I'm 30, whatever, you know?
Yeah, you know, it's true. I mean, people have different developmental capabilities, but one of the things I will say, when
Mm-hmm.
people are highly stressed, they regress. And
Yeah.
so what made them comfortable at 5 is probably what the 31-year-old really wants to do. They may not feel they can suck their thumb or whatever, but you know, may not be feel appropriate. But actually, a lot of what you find is people who are really stressed as adults, they home to the parents, and they want to be taking. You know, I used to remember. I used to do this when I rarely would get ill or allow myself to be ill or take the sick role. I always push myself. But every once in a while, like maybe once every 5 years, I would decide I could do it. You know, like I had the flu, I had a fever, and I didn't have to be somewhere that was really important. So I would go, okay, and I would announce, I'm sick. And then and I would go through the same thing, and I would say, I want, you know, cinnamon toast, and it has to be white bread, and the crusts have to be cut off because that's what my mom used to do, and I need them in triangles. And my wife would always look at me and go, we don't have, I go, well, you go out and you buy it. Like, I am sick. This is what you do. And I wanted ginger ale. It had to have a 6 straw that bent, you know,
Uh-huh.
because, and that's the only time I would use them. And at one point I found my wife she had this stuff and she hid it for waiting for the next time. And I found it and I go, what are you doing? And she goes, well, one day you will ask for the 6 straw. And I go, when I ask for the 6 straw, you go to the store and you buy it. You know, like, you don't plan for me being sick. When I'm sick, it's inconvenient to you. But I mean, the thing is, she understood that. And that's what my mother did, you know? And so, so part of what I will say is, if you find strategies that work for you now, you got them for the rest of your life.
And I just want to say, I
Cool.
think I'm in the developmental stage in my life where I'm ready for self-hypnosis. I want to try that. You know, I actually remember the first time I talked to you about self-hypnosis or hypnosis in general, because when I think of hypnosis, all I think of is like a state fair where there's a guy and there's a stage and he's taking people who are susceptible from the audience and he's making them dance like Lady Gaga on stage. And that was my interpretation of hypnosis. But David was actually like, no, it's actually a well-researched methodology that is evidence-based. And I was like, what? Like, no, I couldn't even imagine that. So I appreciate the idea that there are multiple different ways that people can access those same strategies.